Good afternoon, and welcome to the second day of the West Virginia Student Success Summit. Currently, you are in the session entitled LGBTQ and Mental Health. Our presenters today are Mel English, Jordy Yarnell, and Perrin Robinson. I hope I said that correctly. If you found yourself in the wrong session, please click on the sessions in the toolbar on the right side of your screen and find the session you would like to attend. To ask questions in the session, please note the words event and session to the right of your screen. You can click on session and then Q&A. Within the Q&A column, you will see a prompt that says ask a question. At the bottom right of your screen, a moderator will keep an eye on the chat to let our presenter know if questions come up during the session. CEUs have been approved for LPCs, social workers, and school psychologists. You can get more information about the CEUs on in the reception area on the event page. After the conference, a link will be emailed to you for an online evaluation. An evaluation must be completed for each qualifying session within 2 weeks of the date of the evaluation link is emailed. After completing the evaluations, a CE certificate will be available for download. As I said, you can find more information about that in the reception area. Our first presenter is Mel English, a postdoctoral fellow with the University of Maryland School of Medicine, where they work on child and adolescent psychiatric inpatient within the University of Maryland Center. They also completed their predoctoral internship within the Child Inpatient and Pediatric Consult Liaison position at UMMC. Mel will earn their doctorate in clinical psychology from Chestnut Hill College in Philadelphia next month, and they have earned their master's in clinical psychology within their doctoral program in 2017. Mel has completed their clinical training within a variety of settings, including residential, outpatient, and inpatient settings, where they have been able to work with LGBTQ youth and adults, including working for a year with Comhar, Inc., Specialized Services, a community mental health center in Philadelphia that serves LGBTQ plus individuals and individuals affected by HIV. Most recently, Mel has been working on program development efforts on the Child and Adolescent Inpatient Unit, where they have begun system modification efforts with regard to the admission process and documentation using electronic record systems. Mel has also been passionate about using a DBT-informed approach with LGBTQ and plus adolescents on the inpatient unit. Our second speaker is Dr. Jordy Yarnell, a clinical psychology fellow with the University of Maryland School of Medicine, National Center for School Mental Health, and a licensed psychologist. He earned his PhD from Florida State University in counseling psychology and school psychology with a focus on working with kids, teens, and adults that care for them. Dr. Jordy has served youth by providing therapy, consultation, and psychological assessment in a variety of settings, including Boys and Girls Clubs of America and public schools in Northwest Florida and Houston, Texas. Dr. Jordy currently serves youth by providing school-based mental health care in Baltimore City. Dr. Jordy also contributes to the development of teacher training and information. I'm sorry, someone put their mic open. I'm so sorry. Dr. Jordy also contributes to the development of teacher training and information for families on social-emotional learning, cultural responsiveness, inclusivity, and equity. In addition, he provides program assistance for youth social service workers and youth substance use interventions. His research interests involve talent development and the impact of resilience and social-emotional strengths on student success. Our third presenter, since 2016, Perrin has supported the National Center for School Mental Health across a variety of research projects on teacher, student, and young adult adolescent wellness. He enjoys his roles in qualitative and quantitative data collection, management analysis, and reporting on program evaluations. As of 2018, Perrin oversees communications at the National Center for School Mental Health, including management of the website and social media, as well as assisting with the annual conference on advancing school mental health, where he is a co-facilitator of the cultural responsiveness and equity specialty track. He currently serves as the evaluation specialist for Maryland Healthy Transitions and is the advisory board for the National Center of School Mental Health. So, welcome, and we are glad to have you here. We look forward to your presentation today, and I'm just going to turn it over to you. Thank you.
Thanks so much, Kelly, for those intros. We're just going to go around real quick and introduce ourselves with our pronouns. My name is Jordy. My pronouns are he, him, and his.
My name is Perrin Robinson. My pronouns are he, him.
And my name is Mel English, and my pronouns are they, them.
Thanks, everybody. So we're really excited to be here with you today, especially as it is Non-Binary Awareness Week. So we hope that attending this presentation is a part of your celebration of Non-Binary Awareness Week, and that you're able to continue celebrating by taking some of the information and resources and knowledge that you gain from our time together and sharing it with your community and helping to make your community and the spaces where you serve youth more inclusive, more affirming. So today we're going to cover three main objectives. The first of which is that we hope that you will be able to better describe the mental health challenges experienced by LGBTQIA youth. We're also hoping that you will be able to understand a little bit more about how the pandemic exacerbated the mental health challenges experienced by LGBTQIA youth, and that you'll also be able to take with you some recommendations and resources to support LGBTQIA youth in your communities as well. So as we start off today, we wanted to share three sort of expectations and agreements. We're going to be talking about some challenging real life experiences that youth go through. And a lot of the times when we talk about violence, trauma, suicide, other social issues that are hard for kids and adults, it makes people feel a little bit uncomfortable or can make people feel overwhelmed or a variety of really big emotions. So we ask that you stay engaged and present as much as possible during our presentation. However, we also understand if you've got mute your computer, take a few steps away, go take a break, grab a snack or something, and then come back and join with us. We ask that you engage as much as you feel comfortable. If you need to take a second to step away, we do ask that you come back just so you can make sure that you get all the content. Also, these sessions are being recorded, so afterwards you'll be able to look back in, and we're also planning on sharing the slideshow with you as well. We also recognize that we're going to be talking about a lot of really big system-wide issues that we aren't going to be able to just make go away and through our individual work. So we ask that you all focus on your personal, local, and immediate spaces where you can make a change, whether that's in the communities where you work with your loved ones and at home, or in your local government. We're all at different stages of learning about how to support LGBTQIA youth. And we just ask that you pick up from where you are and continue to learn and grow alongside of us. So we're going to start off today with talking through some vocabulary. For some of you, this vocabulary might be a refresher, while others of you might be hearing some of these terms for the first time. And for many of you, it might be a combination of both. So today we're going to start off with going over a couple different catch-all terms. So the first of which is SOGI, which is an abbreviation that's common in research and organizations, and it's used to refer to all people's sexual orientation and gender identities. The second one is maybe the most common, and it's in our title, right? The abbreviation LGBTQIA+. It's an acronym for lesbian, gay, bisexual, transgender, queer, questioning, intersex, agender, asexual, and aromantic, as well as other gender and sexual minoritized identities. And in just a couple slides, we'll go over the acronym a little bit more in depth. We also wanted to share about queer people, which is used as a catch-all term to include many different people, including those who don't identify as exclusively straight, and or folks who have non-binary and gender-expansive identities. We also wanted to mention the acronym SGM, which encompasses LGBTQIA populations, as well as those whose sexual orientation, gender identity, and expressions or reproductive development varies from traditional social, cultural, or psychological norms. There's also an important linguistic distinction when we talk about minorities versus minoritized identities. Used as a noun, minorities can imply that a group is less than due to their physical presence or representation. And a language shift to the verb minoritized shows us that, and other people that belong to minority groups, is a result of dominant groups forcing those communities of people into the margins of society through invalidation, prejudice, and discrimination. So like a quick example of that and how that happens to individuals in the LGBTQIA+ community is the lack of options for self-identification on registration forms, either in healthcare settings or at schools, other than male or female. A couple other quick terms. We've got a number of different examples of these different terms on this slides, but I'm going to share with you what they are, what each one of these different identities is. So sexual orientation is emotional, romantic, or sexual attraction to other people. An individual's sexual orientation is independent of their gender identity. And somebody's gender identity is one's innermost concept of themselves, as male, female, a blend of both, or neither, and how individuals perceive themselves and what they call themselves. One's gender identity can be the same or different from their sex assigned at birth. Somebody's sex assigned at birth is the sex that a doctor or midwife uses to describe a child at birth based on their external anatomy. Somebody's gender expression is an external appearance of somebody's gender identity, usually expressed through either the way that people act, the clothing that they wear, different body characteristics or voice, and it may or may not conform to the sort of socially defined behaviors and characteristics that are typically associated with being either masculine or feminine. A person's gender identity, experience, or expression does not imply their sexual orientation. Two-spirit is a term used by the Native and Indigenous communities to describe people who occupy a distinct gender status. Two-spirit people fill special roles as healers and ceremonial leaders in their tribes. They hold a preference for an achievement in roles that aren't necessarily traditional for their sex assigned at birth. And by doing this and engaging in these activities and combining activities, two-spirit members often hold high status in their tribes. Somebody's gender experience is whether or not somebody's gender identity and expression are different or the same as cultural expectations based on the sex they were assigned at birth. And somebody's pronouns are the way that people refer to us when they're speaking about us. Neopronouns are a category of gender neutral pronouns that are used. And so you'll see maybe some pronouns that you've heard before, as well as some new pronouns. These and zir are three examples of neopronouns. So people whose gender expression is the same as cultural expectations based on the sex they were assigned at birth are known as cisgender, while people who are transgender or trans those are sort of used as umbrella terms that provide an affirming space for people whose gender identity or expression is different from cultural expectations based on the sex that they were assigned at birth. So this graphic shows a couple terms that are outdated and some consider to be offensive: transsexual and transvestite. But that aside, we really like the way that the graphic shows the many identities that people who might identify as trans might choose. So a person who's trans is trans if they say that they're trans, and it's not our place to say whether or not somebody who holds any one of these identities is trans or is not trans. We have to trust people's understanding and expression of their own identities. And some people who hold the identities under this umbrella might not consider themselves trans, while other people who hold the same identities may. So on this next slide, let's see, Karen, thanks, Karen. So on this next slide, we look a little bit more closely at the LGBTQIA acronym. And you'll notice that some of the identities in the LGBTQIA acronym are related to someone's sexual orientation, while other identities are related to somebody's gender identity, expression, experience, or sex assigned at birth. And still other, and then the Q for queer and questioning applies to both sexual orientation and gender identity. Finally, we wanted to share with you the gender unicorn, which provides a sort of visual interactive opportunity for people to find themselves on the sexual identity and orientation and gender expression spectrums. Something that I particularly appreciate about the gender unicorn is that a person can express their understanding of themselves across different identities at the same time. For example, a person's gender expression can be masculine, feminine, and non-conforming rather than only fitting into one category. And so next, I'm going to turn it over to Perrin, who will talk a little bit more about the mental health challenges experienced by LGBTQIA.
Thank you so much, Jordy, for getting us started and for rooting us in with an excellent refresher on terminology. So I'm going to be speaking today about some mental health challenges that LGBTQ youth experience. I'll often use the term queer. I am comfortable with using that term, so you'll probably hear me use that a lot. Also LGBTQIA+. So in understanding the mental health challenges that these groups of people experience, I think it's really important to first root that in what they are experiencing in society. We know that what people experience in society is directly connected to their health and well-being. So I want to start by a quick understanding of intergroup bias, because this has a big impact on how groups that are minoritized, as Jordy said, the different types of experiences that they have. So there's three types of intergroup bias. One is stereotypes. This is the cognitive aspect of intergroup bias. So intergroup bias just meaning our biases between our own group and other groups of people. So this refers to beliefs, cognitions, knowledge, and thoughts as the cognitive part of it. Then we have the feelings side of it, which is prejudice. So that's our attitudes, evaluations, or feelings about a group of people. And then finally, those come together and lead to discrimination, which talks about how we treat people, the different policies and practices that influence people, and microaggressions, different actions that we take. These can all be examples of discrimination. So all of these things work together to impact the health and wellness of groups of people who are often on the receiving end of discrimination. I also want to bring up here, and I know this is maybe a lot to take in visually, so I'll leave it up as I'm explaining this. But when we're talking about discrimination and prejudice and oppression, we're not just talking about one area at a time. So a lot of LGBTQ youth and adults are not just experiencing discrimination and prejudice because they are queer. Many of them are also experiencing it because of their socioeconomic status, their ability status, their education, their race, their nation of origin. There's all sorts of reasons why somebody might be experiencing more or less power or privilege at the same time. And this is really well understood with the concept of intersectionality, which was coined by Kimberly Crenshaw. She used this term in the early 90s, I believe, to describe how Black women were kind of falling through the cracks and being subject to legal loopholes in terms of employment policies and laws. So employment policies and laws at the time were saying that you have to hire Black people and that you have to hire women. But the women that they were hiring were all white, and the Black people that they were hiring were all men. And so Black women were falling through the cracks and were unable to obtain employment at the same rates. So intersectionality is the term that she coined to describe this, how being Black and being a woman at the same time creates new intersections of marginalization and discrimination. So this is intersectionality, a lens through which you can see where power comes and collides, where it locks and intersects. It is the acknowledgement that everyone has their own unique experiences of discrimination and privilege. So as I mentioned, this is happening across all sorts of domains at the same time. You can see over here on this wheel of power and privilege, those identities that are closer to the center have more power. And then as you move out, the identities on the edge of this circle or on the edge of this wheel are more marginalized, have less power and privilege, experience more discrimination. And these graphics come from Sylvia Duckworth. You can find these on her Instagram at Sylvia Duckworth. So what specifically does this, talks of power, discrimination, privilege, what does this look like for queer youth, and what are the impacts of that? So the main overarching categories of ways in which discrimination occurs against LGBTQ youth are heterosexism and cissexism. So one of these is about sexual orientation, one of these is about gender. So heterosexism is about sexual orientation. It's the systems, policies, and practices that promote heterosexuality and ignore or punish homosexuality. Within that, we have this idea of heteronormativity, where society and people within society view heterosexuality as the good, the normal, the default orientation. You might have heard people who are queer say that it feels like they have to come out over and over again. It's not that you come out once. And that's because of heteronormativity, because of this expectation that you are straight and you are cisgender until proven otherwise. Related to that, we have homophobia, the irrational fear of or aversion to gay people. And related to that, we also have biphobia, the irrational fear of or aversion to bisexual people. So that's the sexual orientation discrimination. The gender discrimination is called cissexism. These are systems, policies, and practices that promote being cisgender. So cisgender meaning your sex assigned at birth matches your gender identity, and ignore or punish being transgender. So along with that, we have cisnormativity, that being cisgender is the good, normal, default experience, and then transphobia, which is the irrational fear of or aversion to transgender people. So some of the ways that heterosexism and cissexism display themselves, one of the big ones is through family rejection. So there's a lot of research that's come out of Dr. Caitlin Ryan from San Francisco State University and the Family Acceptance Project. While many families are hoping to have loving responses to their youth when they come out, they may engage in any sort of behaviors, and those behaviors can be classified as accepting or rejecting. So some examples of rejecting behaviors are preventing children from making connections with other queer people, not respecting or using the child's correct name or pronouns, and some pretty heavy research findings that just came out from the Trevor Project show that queer youth whose families or the people that they live with respect and use their name and pronouns are half as likely to attempt suicide as queer youth whose family do not respect and use their name and pronouns. So youth who are queer are twice as likely to attempt suicide when their name and pronouns are not respected and used by their family. So the role of families here is really huge. Some other examples of rejecting behaviors from families can be trying to change the child's identity through conversion therapy or other similar practices, physical and emotional abuse, controlling how the child dresses, acts, or behaves, making the child leave the home. And unfortunately, making the child leave the home is all too common among queer youth. Queer youth are way overrepresented in the populations of people who are lacking housing. So queer youth are up to 120% more likely to lack housing than their cisgender and straight peers. So you can see here, while queer youth are about 7% of the general population, they're about 40% of the population of youth who are lacking housing. So they're way overrepresented there. Queer youth are also facing discrimination and violence at school. So we know that based on some reports from GLSEN, the Gay, Lesbian, and Straight Education Network, so their research in 2009 showed that about 95% of students had heard homophobic remarks at school in the last year, and over half of them had heard homophobic remarks from teachers or school staff. So it's not just coming from other students, it's coming from the adults who are in the building as well. 87% heard transphobic remarks. 58% of queer youth were sexually harassed at school, and almost half of them are avoiding bathrooms or avoiding locker rooms. So this is pretty heavy stuff that's showing that there are tragically high rates of discrimination and violence at school against queer youth. They experience physical harassment and assault and verbal harassment. So for physical harassment, you can see these are broken down by why they are experiencing the physical harassment. Is it because of their sexual orientation, their gender expression, or their gender or gender identity? So you can see around 21 to 25% are experiencing physical harassment. Around 10% are experiencing physical assault at school. And over half, sometimes even up to 68, 69% are experiencing verbal harassment. So there's very high rates of verbal, physical, and sexual harassment and assault of queer youth in schools coming from both students and adults. So the queer youth are dealing with all of this stress, all of this pressure, this discrimination. It happens in healthcare as well. A lot of queer people end up having really difficult or discriminatory experiences in healthcare and end up avoiding seeking healthcare altogether because of that, out of concerns for discrimination. We also know that the laws and policies in an area we're increasingly seeing evidence that they are connected to the well-being and the health of queer individuals in that area. So anti-discrimination protection is incredibly important. It's crucial. This past legislative session, we've seen tons of state-level attacks on queer rights. As of May 7th, there were over 35 bills prohibiting transgender youth from being able to access best practice, age-appropriate, gender-affirming medical care that were introduced in state legislators. As of July 7th, there were over 200 anti-LGBTQ bills going around state levels in 35 different states in the US. And again, we're seeing that when there is anti-LGBTQ policies and legislation, that does have detrimental effects. There's been some emerging research showing that calls to suicide hotlines from queer youth are increasing after these bills are passing. So these are very detrimental to the health and well-being of queer youth. So all of these stressors altogether are leading to physical, mental, and behavioral health disparities. This is a lot going on. This is a lot to navigate. And as we mentioned with intersectionality earlier, many youth are navigating multiple systems of oppression and discrimination that are overlapping with each other. So one of the ways in which this is happening is the effects of this discrimination, oppression, and prejudice are not short-term. They can have long-term detrimental health impacts. So we know that across the lifespan, sexual minority adults are more likely to experience mental health and substance use and abuse issues overall. We also know that perceived stress, so how you feel about the stress that you have, can be related to the telomere length, which you can see on this diagram as part of the end of your chromosomes, and those are connected to both your overall health and your lifespan. So being exposed to chronic stress can shorten your lifespan. Also within queer communities, the rates of health issues are not evenly distributed. There are subgroups that pretty consistently are experiencing higher rates of mental and physical health outcomes or negative outcomes. So we see that particularly with bisexual people. I mentioned biphobia earlier. There's discrimination against bisexual people that occurs both within and outside of queer communities that contributes to added pressure, stress, and discrimination. Same with transgender people, asexual people, and Black and Indigenous people, and people of color. So across the lifespan, we're seeing concerns here. In terms of mental health disorders and diagnoses, the Trevor Project's 2021 National Survey on LGBTQ youth mental health just came out a few weeks ago. And they found that in the 2 weeks prior to the survey being conducted, 72% of queer youth were showing symptoms of generalized anxiety disorder. And that's over 75% of transgender and non-binary youth. 62% were showing symptoms of major depressive disorder, and over 2/3 for transgender and non-binary youth. Nearly half of the youth they surveyed wanted counseling but weren't receiving counseling. And 70% said that their mental health was poor most of the time or always during COVID-19. We see high rates of PTSD and major depressive disorder along with anxiety disorders in queer youth, higher rates than the national average by a long shot. And then again, as I mentioned earlier, across most of these disorders or mental health concerns and issues, we see higher rates among bisexual and transgender groups of people. All right, so all of this has been pretty heavy so far, and this part is, I think, the heaviest. So this is where we're going to talk about suicide. The rates of suicidal ideation and attempts among queer youth are incredibly high. So based on the Youth Behavior Risk Survey, 46.8% of lesbian, gay, and bisexual high schoolers had seriously considered dying by suicide within the last 12 months, and 23.4% attempted. So a quarter of lesbian, gay, and bisexual youth were attempting suicide in a 1-year period. A quarter of them. And this is compared to about 6.4% of their heterosexual peers. So the prejudice and discrimination that lesbian, gay, and bisexual youth are experiencing is vastly increasing the likelihood that they are going to attempt suicide. And I mentioned earlier the role of family acceptance and rejection. So LGBT youth whose families highly reject their sexual orientation, they do a lot of those rejecting behaviors, are 8.4 times more likely to attempt suicide than their peers who are not rejected by their family members. So getting families on board, which the Family Acceptance Project does have a lot of tools to help with that, is very important to the health outcomes of youth and very important in reducing the risk of suicide. So for the general population, lifetime prevalence of suicide attempts is roughly 4%, but it's around 20% for lesbian, gay, and bisexual people, so 5 times higher. The highest subgroup there is bisexual people. Remember, we said they do face added discrimination. And it's even higher for transgender people. They often have some of the highest rates of suicide attempts at just under 50%. So lifetime suicide attempts for trans men is 46%, and for trans women is 42%. So again, the discrimination, prejudice, and oppression that transgender people are facing means that almost 1 in every 2 of them is going to attempt suicide at some point in their life, which is really highlighting the need for supportive, inclusive environments. Like, we should be doing everything that we can at this point, because this is a major, major problem that deserves a lot more attention than it has been getting. There's also some subgroups within transgender people who are experiencing even higher rates. People who are younger, 18 to 24, so just out of high school, people who are Native and Indigenous, people who are educated at the high school level or lower, and people who are earning under $10,000 a year. We also see disproportionate health outcomes in sexually transmitted infections. We also know that the effects of the HIV/AIDS epidemic were traumatic for some people, and that the response from society plus the trauma of going through that still lingers. We see higher rates of substance use and abuse with queer people. So compared to cisgender and heterosexual counterparts, queer people use substances at higher rates, are more likely to suffer from substance use disorders, and enter substance use treatment with more severe disorders than their cisgender and heterosexual counterparts. So lots of research over the years has identified many risk factors and many protective factors to support and help queer people in having positive health outcomes. And this is all very connected to school. This is a student success summit, right? We want our students to succeed, and we know that when students are healthy and well, that they are going to be learning better. And we know that when students are not healthy and well, they are not learning as well. So the marginalization they experience in society is connected to their physical, mental, and behavioral health, and that's connected to their academic performance and their academic success. So when we focus on the protective factors, when we are supportive and inclusive and treat people equally and have anti-discrimination protection, all of those things are going to improve the health and well-being of a group that's facing a lot of discrimination, and they're going to improve their academic performance as well. So I'm now going to turn it over to my colleague, Dr. Mel English, to talk about how the pandemic has factored into all of this.
Thanks, Perrin. So I'm going to be focusing on how the COVID-19 pandemic has impacted LGBTQIA+ youth specifically, and I'll be sharing both from my experience working on the child and adolescent inpatient unit, where about 1 in 4 patients here, at least in the adolescent age that we've had over the past year, have identified within that community. And I will also be touching on a lot of research that focuses on the pandemic. So according to the 2021 national survey by the Trevor Project, 70% of LGBTQ youth, as Perrin said that their mental health was poor most of the time or always during the COVID-19 pandemic. And then specifically looking at transgender and non-binary youth, 85% said that the COVID-19 pandemic has negatively impacted their mental health. And then 78% of transgender and non-binary youth said that their mental health was poor most of the time or always. And that's compared to 61% of cisgender youth. So we're seeing quite alarming stats. A couple more stats coming from the Trevor Project in their report in 2021. So nearly half of LGBTQ youth said that the COVID-19 pandemic impacted their ability to express their sexual orientation, and 60% of transgender and non-binary youth said that that the pandemic impacted their ability to express their gender identity. So it's quite evident that the pandemic has significantly impacted this population's daily functioning, ability to just express who you are and the kind of basic needs in that way. So I'm going to be talking about the minority stress model, which has been adapted by Meyer in 2003 and then 2007, focusing on first the LGB population. And on the next slide, I'll show this model, which is a little bit complicated, but really this model shows that stigma, prejudice, and discrimination create hostile and stressful social consequences that lead to mental health problems, specifically in this community. And this model has also been applied to transgender and gender nonconforming individuals with some very recent research in 2020. So on this next slide is the model itself. And there, it is a little bit complicated, but kind of the major takeaways. This model shows that circumstances in our environment, especially related to stigma and prejudice that we've already talked a little bit about in this presentation, bring about stressors for individuals within the LGBTQIA+ community, and they experience throughout their entire lives. So there's distal and proximal factors that are included in this model, and distal stressors refers to events and experiences outside of the person. So this is the prejudice, the discrimination that individuals face in their everyday events in life, chronic strains, discrimination that they might experience, just related to going to the bathroom, and then microaggressions that happen all the time. And then proximal stressors refer to stressors that occur through the socialization process and are experienced using cognitive processes. So this is when we talk about internalized homophobia and internalized transphobia, expectations around rejection and discrimination, which is like felt stigma, and then concealing one's identity in some way. And these all lead to mental health outcomes, which are often negative within this community. So self-harm and suicidal ideation is something that we see that's very common, especially on the inpatient unit here for these youth. But it also speaks to how, if these factors can be improved in some way, how it can lead to positive mental health outcomes as well. So really what I'm going to be focusing on is two factors in the period of time that the pandemic has existed for LGBTQIA+ youth. And this has been an increase in family rejection and or perceived invalidation. And then this has been a decrease in community support for these youth. And these two are important because, and I'll get more into it, but really because of social distancing, youth are at home more of the time with their families, so they're feeling the family rejection and invalidation more. And because they've been at home and have been restricted or limited from the community and being around people who are like them, a lot of the times they have been limited in terms of community engagement. So here on the right is a graph also taken from the Trevor Project in their report in 2021, and it just demonstrates where LGBTQ youth access affirming spaces. And as you can see, in the past year specifically, or a year plus, online has been the biggest source of support and the most affirming space for these youth. And then school is the second most. And then home is the least affirming kind of context. So with regard to an increase in family rejection and invalidation, these adolescents, there has been research that has found that these adolescents experience strained relationships, so invalidating home environments due to stigma. And I have to just say that I am on the inpatient unit, so if you hear any noises, that's where that's coming from. And related to sexual orientation or gender identity. And then according to this Trevor Project's 2021 report, again, more than 80% of LGBTQ youth stated that the pandemic has made their living situation more stressful. So that's 80%. And only 1 in 3 of these youth found their home to be LGBTQ affirming in terms of that space. And again, this is due to the limits around social distancing, having to be at home more. If their family is already invalidating or is rejecting, it's just increased. So family rejection, as we talked about a little bit already, has been found to be strongly associated with mental health problems among this population. And parental support has consistently been found to be one of the strongest factors related to mental health both positive and negative, in the transgender and gender nonconforming adolescent population. And then thinking back to that minority stress model that I mentioned, the distal forms of minority stress, including like family rejection and victimization, may also increase proximal minority stress. So if there is more family rejection or invalidation from the family environment, then the internalized transphobia or homophobia or both is going to be likely increased as well. And then this in part relates to the psychiatric symptoms that we see increase, distress overall, and then the suicidal ideation and attempts that we have also discussed. So the second factor that I'll touch on is that we know that LGBTQIA+ youth who have access to spaces that affirm their sexual orientation and gender identity do report lower rates of discrimination, and then as well as better mental health outcomes. So lower rates of attempting suicide than those who do not. We know it's good for individuals to have that community support. However, again, due to the social distancing, there have been fewer opportunities, and I have this picture of Pride on the right. It's been a huge bummer that Pride has been, canceled in many or most cities. So having just fewer opportunities to celebrate oneself or to feel recognized or to feel like they can relate to others. And there have also been other kind of limitations around community support, not just Pride, but also having like a Gender and Sexuality Alliance or GSA in school. So if schools are online or if they're not able to hold these community events, then there are fewer opportunities. If we're virtual or it's limited in school in some way, then we're having fewer supportive educational staff interacting with these youth. And then there are fewer other extracurricular activities. And then just wanted to note that, yes, telehealth has been amazing, but one factor for this community specifically is privacy. So a lot of youth, LGBTQIA+ youth who have telepsych access and have been, seeing a therapist luckily, or having psychiatry services, they have been probably afraid of sharing things within, the walls of their own home, just out of fear of, parents or family members overhearing what they're saying and what they're disclosing. So on the next slide, there is a need for evidence-based treatment for these youth, given a lot of the disparities that I've touched on. And specifically talking about this increase in risk for self-harm and suicidal ideation and attempts, we need interventions that directly address these, as well as those that can hold and appreciate the nuances of the LGBTQIA+ community and the needs for this population, and understanding and having an affirming space for these. So I am really biased in that I love dialectical behavior therapy, or DBT, and I'm going to share a couple things that are really cool about DBT, even if you've never heard of it. This comes out of cognitive behavioral therapy, and it has been adapted to specifically address suicidal behaviors by Linehan, and then it has been adapted for different populations, including youth. So DBT, a little bit about it. It involves reducing environmental stressors and applying strategies for increased coping or increased adaptive behavior. And on the right, there's a picture of the theory that underlies DBT is this notion of pervasive emotional dysregulation. And when we have emotional sensitivity in an individual for various reasons, biological, otherwise, and then we also have an increase in invalidating environments, we see more pervasive emotional dysregulation. And this is the biosocial model. And so, for example, for transgender and gender nonconforming individuals, they often experience invalidation when their identities or their expression is rejected, punished, or negated by their social environment. So it really is a good match. So DBT skills are things that there are manuals that you can kind of access or purchase. There's also been skills that have been adapted online that are free to the public to look at. And I really like DBT skills because you can kind of use a skill and you don't necessarily have to do like the whole model in order to use a skill or adapt it in some way. So I'll talk a little bit about that. And Sloan and colleagues have identified 4 patterns that have been identified within DBT that are a good match for transgender individuals specifically. So first is problems identifying or experiencing the self. Emotional dysregulation is the second one. Interpersonal difficulties, and then impulsive or problematic patterns of behavior. That DBT addresses all of those things. This is a good look at the adolescent manual, the skills manual for DBT. And this includes mindfulness, emotion regulation, interpersonal effectiveness, and distress tolerance, as well as walking the middle path skills. And there's a little description under each one. And I'll share just a couple examples of skills that I've used, but you know, you can look at each one of these components and really find a good match for these components within the LGBTQIA+ community in terms of how it's applicable. And then I'll quickly share a case example. I'll keep it pretty vague just for the sake of time because I want to get to the resources that we have and any questions. But Brian is a fictitious name, but it is an example of a case that we've had on the inpatient unit, a 13-year-old white individual who has been questioning his gender identity using he/him pronouns. He was admitted for worsening depressive symptoms, self-harm behaviors, and then suicidal ideation with a specific plan. So he's had prior history of ADHD, and he's had previous inpatient admissions. The family dynamics are super important to consider. Lives at home with dad, as well as 2 siblings. Parents are separated or divorced. Communicates with mom regularly, and importantly, neither of the parents have been using his pronouns that he has used for himself and that he has advocated for. And so there's been some pushback about that I'll talk a little bit more on the next slide. The course of treatment, so I was lucky to be able to work not only as the DBT skills group leader, so 3 times a week we had DBT skills group. I also did individual work with him using a DBT informed approach. And a couple of the DBT skills that I introduced to him related to that interpersonal effectiveness component, which is a skill called Dear Man, and I will talk about that on the next slide, as well as distress tolerance skills, and my favorite skill, which is TIP. For anyone who knows DBT, TIP is all about tipping your body chemistry when you are feeling emotionally intense in order to kind of manage your emotional regulation. And then we also were able to do just 2 very short behavioral parent training sessions that I would have liked to have taken a DBT parent training approach, but this family was particularly, unfortunately, resistant to engaging in this process. So that was definitely a factor to consider. So on the next slide, I will show an example of one of these skills from the DBT Skills Manual for Adolescents. So this is under interpersonal effectiveness, and this is called Dear Man. DBT loves acronyms, and each letter in the word Dear Man stands for a different way or method that you can get someone to do what you want. This is really important for adolescents because this is a crucial developmental time period where you are trying to increase your independence. And for LGBTQIA+ individuals, they're facing this need to be affirmed and supported constantly by having to come out, by having to ask for things that you shouldn't have to ask for, but they have to, like using my name and my pronouns. So I actually worked with this case that I just presented on using this structured approach to communicate more effectively and efficiently with his parents as well as other people in the community about, hey, can you use my name and pronouns? And this is a structured way that you can kind of see describing what are the facts of the situation, sticking to the facts, such as these are my pronouns, I would like you to do this. Expressing is all about using I statements. Asserting is being clear. Reinforcing is all about what are the benefits and what are the reasons why. So it's really just a way to structure, and you can either do this in literal writing or you can use this to kind of facilitate communication. So I just wanted to share that skill with everyone. Oh, and now I will hand it back over to Jordy to talk about recommendations and resources. Thank you.
Thanks, Mel. I started talking and I was muted too, so it was a good reminder. So now we've heard all of these different reasons that it's important for us to create affirming spaces for LGBTQIA youth. And so now I hope that in these next couple slides, you'll be able to gain a couple ideas of things that you individually can do to create spaces that are affirming for LGBTQIA youth. So first, we have some recommendations for caring adults. And so this isn't just for you all, but also for the families of LGBTQIA youth as well, that you serve as well. So one of the first recommendations or references or resources that we have on here is a family acceptance project. Like Perrin shared earlier, acceptance from at least one caring adult can decrease the risk of LGBTQ youth attempting suicide by 40%, according to a survey that was just published this year. And so at this link, there's a variety of different posters for even between more and less conservative families, as far as information on how to support LGBTQIA youth and things that can be ideas for parents and caregivers to be supportive in the home and in other environments as well. The second thing that you all could do is encourage parents to educate themselves. It's really important for us to show, or an important way for us to show that we care about each other and each other's identities is to put some effort ourselves into learning about different people's identities. And so one way that parents of LGBTQIA youth can show that they care is by staying informed about the social and political issues that impact them. And so the burden to educate adults should not fall on youth or on marginalized populations. So I know that we went through a lot of vocabulary early on in this presentation, and it's a lot to digest, especially while I'm talking quickly and especially while you all are getting such a wealth of information in only an hour's time. So we included the glossary of terms from the Human Rights Campaign and a link to that here. We also think it's a really good idea for adults that care for LGBTQ youth to get involved with community organizations. And one national organization that has local chapters is PFLAG, the Family and Communities. It's a family and community support group. They offer education, advocacy, and support. And there's also a film for how to be supportive when someone does come out to you. And we like that film there as well. We also encourage parents and adult caregivers to advocate for inclusivity, both at school and in the community. On the next slide, we have specific recommendations for and resources for school-based providers and school-based staff. So you don't have to be a mental health staff member or mental health service provider to be able to create affirming spaces for youth. So here's a lot of different ideas on how we can create environments at school that are affirming for LGBTQIA youth. One of those things that we can do is provide educational resources to other staff. Maybe when other staff come to us, maybe when other staff haven't come to us yet, but it's just something that we recognize that all staff could benefit from a little bit of extra learning and some visibility as well. There's a number of different places where we can get good information. GLSEN and Learning for Justice are two websites that provide best practices for serving LGBTQ students. They offer a variety of different curricula, lesson plans, educator networks, administrator resources, and toolkits to support your work. It's also important that we advocate and very clearly show our position in our communities on LGBTQIA issues. And if we establish and help our communities to establish inclusive policies, not only establishing inclusive policies for ourselves and environments that we serve, a great resource to help us in that process is this document called Schools in Transition. It was written by a number of different organizations, the largest of which is the Human Rights Campaign. So we'll have this link in there for you all as well. And then some other ways that we've talked about earlier are establishing a GSA or supporting youth who are seeking out a GSA. We have a number of different links in here for different activities, both ways to form a GSA and activities for throughout the year for people who are the faculty supervisors or staff supervisors for a GSA, as well as some of the legal issues related to if you're experiencing some pushback or discrimination against starting a GSA. And I think that the most simple thing that we can do, and the easiest thing that we can do that very clearly sends a message that we're creating a supportive and affirming environment, is to display some sort of sign or symbol or information related to sexual orientation and gender identity. That can either be the Progress Pride flag, like you all see here, the gender unicorn, which we shared earlier, or a poster from the Family Acceptance Project, or something else. And then next, we have some recommendations for youth specifically, too. So we've got recommendations for adult caregivers, recommendations for school staff, and recommendations for youth themselves. On this slide, we have some different resources. So these different recommendations are resources for youth directly. One is to the Trevor Project, which includes a coming out handbook that is directed towards school-aged youth. They also have, like Mo was talking about, there being affirming spaces online. A safe and affirming space that's sponsored by the Trevor Project is trevorspace.org. There's also a toll-free crisis line that's available through the Trevor Project as well. There's also the Peer Listening line, which is through Fenway Health, which is for non-crisis situations where LGBTQ youth can call for information and referrals and support about coming out, locating groups and providers, as well as having safe sex and relationships, as well as information about STIs. There's also a question and answer guide through PFLAG, which is the parent and caregiver organization that we talked about just a few slides ago, for common questions for youth that are LGBTQ, and helpful for allied youth too. Additionally, we've got a couple pointers for youth searching for affirming and knowledgeable healthcare providers. That's both mental health care providers and physical health care providers. Just a couple different ideas to find out how much a healthcare provider knows about serving LGBTQIA youth. And then finally, we have some interpersonal recommendations as well, in general for everybody, no matter if we're an adult or a youth. These are important interpersonal recommendations for us getting along with each other. The first of which is asking and respecting names and pronouns and normalizing sharing our own. It's important that we correct people who use incorrect names and pronouns. Using incorrect names is known as dead naming, and using incorrect pronouns is known as misgendering. There are certainly going to be times where we make mistakes, and when a mistake is made, it's important for us to acknowledge that we made a mistake, apologize one time, and then move on for it, correct our behavior, and be better in the future. It's important when we're having conversations with LGBTQIA people to clarify whether or not someone is out and whether or not, and who they're out to. So we are careful not to out our friends and the people that we care about to people that they weren't comfortable being out with. A great resource I showed in chat a little bit earlier is mypronouns.org, where you can learn more about pronouns. Also, a really important and sort of powerful message that I read from a blog called Let's Queer Things Up by author Sam Finch, addressed sort of what happens and what we're saying, the message that we're sending to people who, when we choose to ignore or refuse to acknowledge people's pronouns. So one of those messages that we're sending is that being who you are is an inconvenience to me, and I'd rather hurt you repeatedly than change my behavior or change the way that I speak about you. Another message that is sent when we ignore people's pronouns is that your sense of safety is not important to me, and it's something that I want to show other people that it's okay to disrespect you. And so it's really damaging and really hurtful for us to just be ignoring pronouns or to say that we're not going to respect somebody's pronouns. The next thing that's really important for us to do interpersonally is to catch and correct assumptions that a young person or anyone is cisgender or heterosexual. It's important for us to reflect before we ask questions of LGBTQIA people, whether or not we've done our own research on the LGBTQIA experience and whether or not we actually need the answer to this question. And is this a question that I would just ask everybody all the time, or is this not an appropriate question for me to ask anybody ever? So questions about things like somebody's genitals are never okay for us to ask each other, and would be inappropriate for us to ask anybody. It's also important for us to speak up against homophobic and transphobic remarks. And it's important for us to advocate for inclusivity in hetero and cisnormative environments too. So I see that there's a lot of different links that got shared by Kelly. Thank you so much for that. This slide has all of our contact information. We hope that you've learned something today. And if you all are here for another minute or two, I'd love to see in chat the different things that you are going to do, or some one action item that you could share with us that you're going to do from this presentation today to make a space that you are in more affirming for LGBTQIA youth.
I'll keep an eye on the chat here for a few minutes. Thank you all so much for this wonderful presentation, and I look forward to getting the PDF so I can share with everyone all the great slides and resources. This is very helpful and timely, so I'm really glad that you guys were here. There is a plenary session, I guess the final one that's breaking out at 3:15, so some people may move on to that, but if you guys have a few minutes and want to stay, this session will automatically end in 5 minutes, but I'm happy to stay here if there's any questions. It looks like there is a couple of questions over here, so if you're able to see those, I'll let you answer those. If not, I can read those to you.
Sure, I can see them. I see Amy's question: is there a place where we can acquire free posters, stickers, and such to post in our classrooms that we're an ally or a safe place? So Perrin also just shared the Family Project poster. A lot of these posters and information that we are going to share in this presentation are available online. One of the best things that you can do is just go ahead and print a color picture of the posters, and maybe you can use your school resources to laminate it if you feel like you're able to be a little bit fancy, or just printing out some of these posters. The Family Acceptance Project has 8.5 by 11 versions of the posters. You can also print out a copy of the Progress Pride flag too. And then I see Perrin also put in chat a safe space kit from Glisten. All right, well, thanks everybody so much for joining us today and taking some time with us. If you have any questions, we're still around for a couple minutes.
Thank you again so much for being here today. We really appreciate it.